Okay, recording. Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. You're laying on your side, so your arm is up in the air, and the socket, the socket is down below here. Everything you see is magnified 30 or 40 times on the screen, and we're just going to get our first look at the biceps tendon, which is the main reason we're here. We know that you have what we call a SLAP lesion, and so here's the long head of the biceps. That right there actually looks okay as it exits the joint, but we can see that you've got some tearing as we get down to the base. And so look down here, see how that's loose and torn, see how this edge is torn. Again, I haven't cut anything or shaved, this is just how we're finding it. So this whole area is detached, and so this is why we're here. We're going to do a biceps tenodesis, which means we're going to release the biceps right now so it can't cause any more pain from pulling on this area that's loose and weak. And so there we go with the biceps. That looks great. Now that it's gone, we're going to push that great cannula back in. I'll show you some more in just a minute. Now we're going to take our shaver. And with our shaver, we're just going to smooth out any areas that are rough. The shaver has a little suction attached to it, so you can see how fast this works to shave the superior labrum here. But you can see how the anatomy is already very different. The long head of the biceps tendon has been released. And now by debriding this torn edge of the labrum, that should take care of the pain that was coming from inside the joint, and the biceps doesn't grow back, and this labrum will no longer be detached, or further detached, because the biceps won't be pulling on it anymore. There's no ligaments that attach right here. So that looks good. I'm happy with the way that looks. We'll look up at the rotator cuff because you're a thrower. This is the articular side of the rotator cuff, the undersurface of the part of the cuff called the supraspinatus tendon, and this looks great, which is what we thought from the MRI scan. No signs of any rotator cuff tear. And as we look down around the back of the shoulder, the posterior capsule looks great. You can see you don't have much arthritis. The glenoid here is pretty smooth. There's some wear and tear changes as expected for somebody in their 40s, but nothing extreme. Then we're going to rotate and look down the front of the shoulder. And what we can see here is some of the anatomy down the front. Now this is a little bit of a fraying here. See, that's the leading edge of the subscapularis tendon. That's part of the reason why we test the strength of this tendon in the office. And you had excellent strength in the subscap despite this small tear in the superior edge of it. Okay, so we'll investigate this a little bit more. If we have to put a stitch in here, we certainly will. But you had really good strength in the office, and so I'm inclined not to if this is the only little frayed portion that we see. So the subscap is okay, it's 95% intact. As you look down the front of the shoulder, these anterior glenohumeral ligaments look fine. And so I think we're done inside the joint. You can see the subscap there now. It's very solid. We've rotated the shoulder, we've stressed it, and it looks very good. So we don't have to do anything else to the subscap. We're going to go ahead and finish up inside the joint. We're going to get to work in the subacromial space in just a minute. Okay, so here you can see we're in the area of the shoulder called the subacromial space. This is up above the rotator cuff tendon. The camera's coming in from the back. That burr that you see is coming in from the side of the shoulder. And we're just taking off a little bit of bone just to make some more space for the rotator cuff. So we're going to stop right there. We're going to switch positions and place the camera where the burr is. We'll show you some more in just a minute. So now the camera's in the side of the shoulder, the burr's coming in from the back, and we're going to take off just this little downward curvature of the anterior acromion. So we'll let the picture clear up. Okay, so we'll keep working and show you some more in a minute. So you can see here We're just working to make this nice and smooth. I think we're pretty much done there. There's lots of room now in the front for the rotator cuff. The next thing we're going to do is make sure there's no spurs underneath the clavicle. That actually feels pretty smooth. I'm right under it right here. And now, hold the camera please. Now we're going to, hold it real steady. Now we're going to look down at the rotator cuff and make sure that there's no problems with the rotator cuff on this side. We've already looked, remember, we've already looked on the articular side, so now this is the bursal side. And as we look down here, we're going to start in the front. And as we keep our shaver pointing up, we can see the cuff. As we look all the way lateral, you can see that there's no signs of any significant damage to the rotator cuff tendon. So that leaves us with the biceps tendon to still fix. That is not an arthroscopic procedure at this point. We're going to do what we call a subpectoral biceps tenodesis, like we talked about in the office. I think it's the strongest way that I have to fix it for you. But this will be the, go ahead and rotate. This will be the end of the video. Rotate. Also, there you go. Can we go the other way? And then we're just looking at the cuff as we rotate the shoulder. Keep going. And that's checking out just great. So this will be the end of the video. And again, here's our bone work up at the top of the screen. Now there's plenty of room for the rotator cuff. We're going to release the portoacromial ligament a little bit. But otherwise, I think we're done with the arthroscopic portion of the surgery. So good luck to you now. Bye-bye.